Hi, we are in the Clinical Learning and Assessment Center of the Philadelphia College of Osteopathic Medicine. Today I'm here to briefly discuss the 3D Systems Lap Mentor VR. I'm here to tell you that this machine is head and shoulders above anything that I've used. Prior to having the VR, we had the system for at least 8 or 9 years now, but with the new advent of the VR, this has taken this machine to a whole different level, a whole new dimension. Out of all the equipment that's here, this machine seems to get the most work. I utilize it from everything from its basic camera skills up into what you see here with our the virtual reality system. What I feel as though virtual reality is the new wave of the future. As you can see from this machine, what we have on screen is an inguinal hernia, and you are fully immersed inside the operating room. You are immersed by the use of these Oculus goggles. And with these goggles, not only can you see, but you can fully experience the operating room while standing in any setting. This machine will allow you to hear all of the sounds that you would normally hear in the operating room. You would hear your monitors, you would hear your suction canisters, you can hear other physicians being paged. You have your own personal scrub nurse who will be able to hand you all the tools that you select. This has now blown the lid off the competition as far as I'm concerned. You can also utilize these tools which will give you feedback. You have haptics which are built into this machine which will actually allow you to feel anatomy. You can feel, like, say for instance, if you are grabbing a gallbladder, you're grabbing an intestine using these tools, you will then be able to actually feel what the resistance, what it would feel like to actually grab them, and you would build an appreciation for the sensitivity that's needed in an operating room. Here we utilize this system from the first time our students step on campus as brand new medical students. We even take it as far as residents, attendings, and anyone who feels the need to come between their cases, kind of bone up on situations, or even practice for a scenario that they're going to perform in a live operating room at a later date. As far as I'm concerned, the future is now. Our learners are becoming more technologically savvy, so why not jump into that realm with them? Everybody has a different learning curve, but this actually takes the time to kind of teach you what you need to know at your own pace. In this machine, we have the ability to track your progress. From the very first time that you use the simulator until you leave, we can extract all of your scores and have them put directly into a spreadsheet where you can see your very first encounter up until your last, what you were great at to start with or what you may need to improve in. What I would say in closing is that if you haven't used this machine, you need to get on it, because it would not only make you a better physician or a better learner, but your patients will thank you in the long run.